But yes, we are experiencing a loneliness epidemic. It's closely aligned to our global mental health crisis. You know, a lot of the activities that I do when I do trainings is helping people become aware of the things that they're doing that might be impacting their ultimate connections. And so you mentioned the smartphone, which is another advisory that the Surgeon General put out, is the, social media advisory for young people as well as adults. And oftentimes I'll sit with people and say, like, all right, pull out your phone. Let's look at your settings and look at your screen time, and let's do a quick math calculation. And what you end up finding is, oh my gosh, I spend 3 months of my life on my phone.
Hi, friends. You're listening to Life Intended, a podcast that explores what it means to be true to yourself and live an authentic and purposeful life. I'm your host, Kelly Berry, and each episode of Life Intended explores my guest's version of personal growth, self-discovery, and the pursuit of becoming the best version of themselves so that you can take what you need and incorporate it into your life to live with more intention and authenticity. Whether you're seeking to develop your leadership skills, overcome challenges, or simply live a more fulfilling life, you will find guidance, motivation, and practical strategies to help navigate your unique journey. Today, I have an amazing expert on the podcast for you. Dr. Julie Radl is a leading expert in the social influences of mental health and uses her experience to create impact within communities, systems, organizations, and individuals. She has extensive experience in behavioral health, public health, and organizational development, and she speaks internationally, is a TEDx speaker, and a published best-selling author. Hi, Dr. Julie. Welcome to the podcast.
Hello. Thank you for having me.
Tell us a little bit more about yourself. I feel like I know you've been in your area of expertise in your field for a long time, and I know it's something, at least for my awareness, that has really become more widely known or more widely talked about in more recent years. So tell us a little bit about like how you got into it and what it's looked like over the time that you've been in it.
So as I've been in behavioral health for over 25 years. I started off at, with my master's degree, working in community mental health, working kind of like on the streets with families that were really struggling, families involved in systems like the child welfare system or the probation system, struggling in education. I've always specialized mostly with children and families. And I became really frustrated working in that space because people were coming in to get support. And they would get, work with the therapist or a case manager or, psychiatrist and get the support that they needed. But once their situation stabilized and then they transitioned back into their life and not coming into, treatment services, 3-6 months later, they'd be right back needing the support of a system. And I thought, we're not doing something right. And I found that really frustrating. So I went back to school and I got my doctor in public health. And in the public health arena, you really focus much more on the prevention side. Like if you think about what happened during the pandemic, there was a lot of talk about wearing masks so we don't get COVID or social distancing so we don't, spread the disease. It's like, let's prevent that from happening. And so I began to look at the prevention of mental health conditions and how do we get ahead of it. And one of the things that they also spend a lot of time talking about in the public health space is looking at inequities or disparities and how, some people have better access to services or the services that they receive support them better based on their culture. And so I conducted a research study where I interviewed families from across the country, families that were African American, and said, is this system working for you? And if not, what's not working? And overwhelmingly, they said, no, the system is not working. And they said that, based on our culture, we don't really want to work with somebody who doesn't look like us, who doesn't have the same life experience that we've had. So we can't relate to them. And we really want to get our needs met through support mechanisms, through our family and our faith and our friends. And so I began to really research that as an equitable response to how do we prevent mental health conditions, is to help build up community. And that's when my research, I got into what I call the social influences of mental health, which really focuses on creating social connections and social support, social capital, managing your social media, and focusing on social inclusion. And so I began to do research. This was all like pre-COVID. And really learned a lot. The workbook that you spoke of, it's activities to teach people how to build their support, their connections, manage their social media, all of the things. Now I train professionals how they can connect better, differently with everybody, regardless of your race, ethnicity, and whatnot, your life experiences, socioeconomic status. We all need to have connections in our life. And then since, like around the same time, we've experienced, as you mentioned, a pretty big uptick in diagnosable mental health conditions. It was happening pre-COVID, but COVID definitely exacerbated the situation. And now we're experiencing a global mental health crisis, which, is largely connected to a lack of social connections. And the Surgeon General of US has talked about how social connections are impacting our mental health, how social media is impacting our mental health, how parental mental health is struggling right now. So there are a lot of different things that we need to kind of all hands on deck focus on so that we can support our own mental health and the mental health of those around us. And especially for me, for you, having young children, the mental health of our children.
Yeah. Yeah. I did see recently that there was, I guess, was it an advisory? What was put out for parents? I'm sure you're very in tune with what that was. What is it?
Basically, he just talks about how parents are really struggling and how parents are very stressed out given all of the challenges that they're experiencing with their children, as well as from their own work lives and community lives. And a lot of it is lack of connection and lack of support. And so, I'm very aligned with the research of the Surgeon General and the advisories that he puts out, because that's what I was studying pre-COVID was social connection, social support. And so, every time he puts something out, I'm like, yes, there's the information, there's the data that I needed to make my case. So it's, it's something that we do need to focus on, because if we can build up our families, our children won't be struggling as much.
Yeah. Yeah, so I told you about your workbook, Connect. I've been reading it and going through it, and it's awesome. And I pulled out a few things that I wanted to talk about specifically because, personally, just to share some of my story, I'm a mother to a young toddler. I have, the past 5 years of my life have looked very crazy. I have actually the past 7 years, I've moved to 2 different states. We had the pandemic. I became a mother. I lost my best friend to cancer. It's just, I've had a lot of things happen in this short amount of time, not to mention just life happening through all of those spaces. And one of the things that, I don't know, it just hit me like a ton of bricks last year is that because I've moved states a couple of times, I am in this bubble where, I had friendships, I had very old friendships, but I hadn't nurtured a community. And then I became a mother and, I just didn't have that. And so it was okay, now what do I do? And how do I get from where I am to where I think I need to be? And I was really starting to feel the effects, mentally and even physically of what this looks like. And so one of the things I pulled out of your workbook is that 1 in 3 people are struggling with loneliness. And loneliness is the greatest indicator of depression. And I think that that's eye-opening because we live in a world where everybody's connected to their phone and we think we're really connected, but the truth is, and the stats say that we're not, Can you talk a little bit about what that looks like? What demographics does that affect the most and how do we take action on it?
Right. Well, you said so much there. So I just want to back up to say, you're right to recognize how the transitions that you've experienced are impacting you. And good for you that you're aware of it and you're being very intentional about building a community, about seeking research and reading the material and trying to be intentional about your practice. And that's really a lot of what I talk about. People say oh, well, okay, fine. If I meditate every day, that's just a Band-Aid. That's not going to change my mental health. Well, the research demonstrates that really only 20% of people who are struggling with their mental health need medication or intensive therapy. The majority of people, 80% of people who are struggling with mental health, their everyday actions can impact the way they feel. And it sometimes feels exhausting to have to wake up and meditate because if you don't, you're going to have that pit in your stomach, and that kind of thing. Yes, it does. But if we know the same thing about physical health, if I don't exercise every day, well, It's going to have long-term effects on the way I feel. And so, yeah, sometimes it is exhausting unless you can find a way to incorporate that into, your life and your world. But yes, we are experiencing a loneliness epidemic. It's closely aligned to our global mental health crisis. A lot of the activities that I do when I do trainings is helping people become aware of the things that they're doing that might be impacting their ultimate connections. And so you mentioned the smartphone, which is another advisory that the Surgeon General put out, is the, social media advisory for young people as well as adults. And oftentimes I'll sit with people and say, like, all right, pull out your phone. Let's look at your settings and look at your screen time, and let's do a quick math calculation. And what you end up finding is, oh my gosh, I spend 3 months of my life on my phone. And so if you spend 3 full months of your life on a box, even though you're connecting with other people, you're not connecting. And it's a different kind of connection. It's not the same kind of connection that gives you the endorphins that you need, that you get when you're face to face with somebody, right? So we have dopamine that from our brain that goes into our body. And when you spend time with people and you have human touch, a hug, something like that, you have increased level of dopamine. When you're just on your phone, not necessarily. And so we want that because that's what makes us feel good. It's the happy, it's the happy drug. So, I think that I love that you're pointing out some of the stats that you find like relevant to, your situation as well as to other people. And thank you for using the book.
Yeah. Well, yeah, last night I was reading it too, and I saw like doing the math of social media, like look at your screen time, look at it for the week, multiply that by for the year. And, most of us are spending between like 60 to 90 full days on our phones a year. And that was like, what? And, I've shared this recently on social media. I'm trying to like take back control of my days and like move my days into alignment with the life that I want to live. And so I've recently decided I was just going to stop checking social media or email before 9 a.m. And because I'm an early riser, like I'm awake for a long time before I get to that 9 a.m. It's probably not going to work for me long time, but the first week that I did it, my screen time was down 67%.
Wow.
Yeah. And I was like, that was eye-opening too. But, really it was just the exercise was for me to take back like the control of the first thoughts that I get in the morning, whether it's stressful emails or, just looking through social media, wasting time, comparison, all of the things. But that's been like an eye-opening exercise for me.
Yeah, I love that exercise. And I love also when people do an audit of how they feel when they're watching it or engaging in social media. Because like there are some things you see that make you feel, and then there are other things that like make you laugh. And if you were very intentional about recognizing what are the things that bring you joy on social media, like watching puppies or things like that, something silly and frivolous, and you can, unfollow the things that don't bring you joy and like more of the things that do bring you joy, then watching social media, you're taking control. You're not letting an algorithm decide how you're going to feel, right? You're taking control of the things that you're using social media for. It's a tool that's here to stay. It makes our lives very productive. And so we just have to learn to see it as a tool.
Yeah. So what would you say is like, I'm 43, a woman, a mom to a young child. When we're talking about loneliness and relationships and like the demographics that it's affecting, is there a demographic that it's affecting the most, or like who's most at risk when we're talking about this?
Well, I mean, in terms of all of the social influences and loneliness, definitely our elderly population experiences high levels of loneliness. There's a whole like arm of research just on senior loneliness, because the struggle is real. When you physically can't move around the way you used to, and the only way you can have human connection is if somebody comes to visit you, then you lose outside connection. And that is definitely a challenge. Certainly vulnerable populations, people with who have disability, that don't have connection. Our young teenage girls are struggling the most with social media. And they have a much higher outcome of depression, anxiety, loneliness, isolation, eating disorders, all of the things. And a lot of that is attributed to access to social media. But what concerns me the most is young people. Because when you are spending time on this device or any device, television, YouTube, it changes, until you're 25, your brain is learning and growing and changing. And it literally, the more time you spend on social media, it changes the way that your brain functions. It changes your neuroplasticity and the way that you learn and the way that you think. And so when young people spend time on social media and you go to a restaurant and the baby's screaming and the parents hand them the cell phone and then the baby's quiet because they're watching the cell phone, and you think like, oh, that's lovely because now we can all have a nice quiet dinner. Well, what's happening to that child? And so it's hard to be a parent when like other people's children have access to these things and you're trying to kind of hold the line. The same thing happened to me when one of my sons was entering high school, and he didn't have social media. He had a phone when he started middle school. He got a phone, but to communicate when to pick him up and that kind of thing. But he didn't have any social media. And when he started high school, the first day of high school, he's sitting at a table with people he really didn't know. And in lunch, all of the kids picked up their phones and they were all on Snapchat and started, chatting with each other. And he didn't have the app. And he's like, Mom, I'm sitting at the table with 6 people and they're all communicating with each other and I can't talk to them. And I'm sitting right in front of them. Like, and I was like this, I'm leaving him behind. I can't do that either. That's not the right choice. So that frustrates me because, their schools shouldn't have cell phones, and kids should be there to learn and to interact with each other. And then, when you do study, like I was, reading a study where they interviewed families from across the country to find out like how they feel about children having cell phones at school. And would they be okay with the children not having cell phones at school? And they're like, no, it's a safety issue. I need to know, God forbid something happens in the school. My child doesn't have a way to contact me. If something's happening in a school, you should not be picking up your phone because that's drawing attention to yourself. So children shouldn't be accessing their phones. That's one of the things they tell them in school. God forbid there's some kind of an issue. And also then we ask families like, well, what are you trying to contact your children about during the day anyway when they're at school? And it was like, what do you want for dinner? So let's not do that,
Like how many years prior to now were people able to make decisions like that without getting input? Yeah.
So it's hard. I get it. As a parent, it's really hard. But I love how the Surgeon General really laid out some guidelines about, do not allow your children under this age to be on the phone. Do not, or, social media or anything like that. So
yeah, it's one of those things as a parent of a young child. I'll say probably 2 things about it. One is you get so many mixed messages on social media, like, no social media for your child, no screen time, no whatever. And then you get the other side where it's like, you need to take care of yourself as a parent. It's okay if like that requires you putting your child in front of an iPad for an hour or whatever it is. So you get these like, it's this pull of, is it my health or the child's health that's more important is basically what the decision that you're making. And the other part of it is, what was I going to say? There were 2 sides of it.
I mean, that's a really good, just right there is a really good, I can see, the discrepancy there. And I'm lucky enough that I'm just like probably a generation ahead of you. Like nobody knew it was bad. So I was able to stick my kids in front of TV, they didn't live there, but I didn't feel guilty about letting them watch a show. And now it's hard as a parent because we have all this science that says don't do it. And you're kind of in this position of like, well, especially if you're like, you're trying to work a little bit, and so how can you physically do that? You can't. So something has to give. And it's a really difficult dilemma.
Yeah. And then the whole, to your point about, like if you hold the line and decide you're going to do this because the science tells you, like people shouldn't have social media before they're 16 or 18 or whatever it came out as, and all of these things, but all of their friends are doing it. And then you're the evil one. Like, Do you have
Yeah.
any advice for parents who are like navigating that? When should I give my child a cell phone, or when should I let them be on social media?
Well, I think really it always comes down to moderation. And that's the key, like if you have a child who, all of my friends are on it. Okay, well then we're going to do this together. It's going to be 30 minutes a day. There'll be certain times that you can check it. And then you have apps that like require that if the child is not on there, they miss their opportunity, or they get further lower in the ranks, and it gets, teenagers all in a fluster because, they're not as cool as the other person who's allowed to just sit on their phone all day long.
Mm-hmm.
But allowing them to explore, I think, is good. Like
Mm-hmm.
what I learned from my son with that situation. And we said, okay, so if you want to have Snapchat, that's fine. I was like, no, not that one. But okay, if you want to have Snapchat, that's fine. But we're going to be regulating it. You can do it at these times of the day. And if you don't do that, if you don't follow that, then the app comes off. Like,
Mm-hmm.
because we don't want you just sitting there. It sucks you in. It is addictive.
Mm-hmm.
Like there's a whole research study that talks about how it does something like it captures and scatters you, right? So it's like it catches your attention, and then it scatters your attention. It scatters your brain so that you can't move on. And then when you see something that you like, it gives you this big dopamine rush, which feels really good. And then you post something and nobody likes it. So you don't get that dopamine rush because nobody has liked it. And then you feel really sad.
Mm-hmm.
Right. And I mean, there's studies that prove this, chemically in your body that this is what happens. And so, how much do we want to do that to ourselves?
Mm-hmm. Yeah. Or allow that same feeling to happen to your child, because for them, it's probably magnified,
Yeah.
because it is, I think you describe it as social capital. Is
Mm-hmm.
that, is that what that is? What does that mean, and how does that show up?
Well, I mean, social capital is really about access to resources, to people, places, and community. So, one of the things in our world that we've really gotten away from is expanding social capital. Like, attendance in faith-based organizations has decreased significantly. And that's a source of community. So if you think about what are the things that we could do over the weekend that could keep my children occupied, going to church might be one of those things, or temple or synagogue or mosque or whatever, you know what I mean? Those are the
Mm-hmm.
things that people used to do where they were face to face and being together with other humans. And now we're not going to church, but we might hop on a Zoom for, convenience sake for a church service or the sermon or something. And that's not good either.
Mm-hmm.
So if we can kind of, I don't want to say get back to old school values, but do the things that we used to do that create senses of community and continue to build our social capital, then we feel a sense of belonging and mattering, which all of those things increase our happiness.
Mm-hmm. Increase happiness. And another stat that I read in your workbook was we live 3.67 years longer when we have stronger social connection.
I know.
Yeah.
And our social connections are decreasing. 30 years ago, everybody had, the average was that you had 3 healthy connections, and now we have 2.
Mm-hmm.
So we're really decreasing. And, in particular, men struggle a lot with their mental health, and their social connection numbers are less than women's.
Mm-hmm.
So that's another area that to be concerned about.
Yeah. So if somebody listening, or like if just we want to improve social connections in our lives, I know the workbook gives you a ton of exercises and audits and things to help you figure out where you are. But what are some like tangible steps that you can take to start either like assessing the relationships that you have to maybe see, are they the right ones? Or if you're looking to make new friends or join new communities, like how can you do that effectively?
I think it's really important to lean into your existing relationships. Like you said, you were so busy and moving, and you kind of lost touch with some of those people that used to be important to you. And that happened to me when I had young children, because I was frenetic, running around with 3 children under the age of 3. And, a few years in, I realized like I haven't talked to my college friends in a really long time.
Mm-hmm.
And it was just this, I need to be intentional about reconnecting with people that give me support, whether that's family members or friends. Another thing is to focus on your interests and the things that you like, and to incorporate that into your life. Because, like, say I like art, and I feel like I'm feeling lonely and or feeling like I really don't have a connection is, well, is there an art class I can go to? Because if I go to an art class, who else is going to be at that class? Other people who like
Other people
art.
who like art. Yeah.
Right. And what are
Mm-hmm.
we going to talk about? Art.
Art.
So like we will have a connection just by virtue of our commonality. So
Uh-huh.
I will incorporate the things that I enjoy. I'll be with people who also enjoy the same things. So there's a pretty good chance that those people will become my people. There will
Mm-hmm.
be people that we have in common. So just thinking about something, if you're feeling isolated, thinking about something that you wish you had more of in your life, a hobby or an interest. And even if you're really super busy, building that into you, like recognizing it's important and building it into your schedule. I mean, for you with young children, I always suggest like Mommy and Me or even just hanging out at the park. But
Mm-hmm.
Mommy and Me is a really good way just because the parents are all sitting there and the kids are like a little bit distracted by the activities, and it really gives moms a chance to talk to other moms.
Mm-hmm.
It's like, you're sitting right next to somebody and their baby's doing something silly and you're going to laugh with them. And then the next thing you know, you're laughing together.
Mm-hmm.
And then the next thing you know, you're going to grab a cup of coffee afterwards or
Mm-hmm.
let's go to the park afterwards. And then that's how friendships really build.
Mm-hmm.
And so it's a time in your life with young children that to incorporate that and, one morning of a week into your schedule, where you'll be around other people who are going through the same struggles that you're going through right now, which it is a really difficult time, a difficult period to have young ones at home.
Mm-hmm. Yeah. So if, I think this is where I was thinking that I had a lot of connections, but in reality, I didn't really. So are there certain like symptoms or ways that people are feeling that let them know that maybe even though you think that you have this good like social health or relational health, that it's not really what you think it is?
Yeah. So there's something called strong ties and weak ties. And so, weak ties, we can have up to 30 weak ties, and those are just like people, like friends, acquaintances, right? But then it's recommended to have 3 to 5 strong ties. And strong ties are like your people that if I needed somebody to pick me up because I had a flat tire, that's going to be my person, and so we want to have 3 to 5 strong ties because then we have a safety net. It allows us to do things, take risks in life and continue to be successful if something happens. And so really it's kind of doing an assessment about like, I look at what I do is one of the activities that I love to do with people is to think about the different aspects of your life or domains in your life. And to think about in each domain, like, do I have a person? And so like, if you think about in your work life, is there one person that you could lean on? Well, I work by myself, but I do have a lot of contracts and people that I work with. And yes, I have work people that I could call and say like, can you just help me? I need somebody to do this for me, somebody to do this with me, right? Think about in your home life, your family, if you're feeling upset about something, is there somebody that would be there for you? Your spouse, your parent, your dog. Think about your extended family, somebody who doesn't live with you, but is still family, a cousin or an aunt or a grandparent, a mother. Yes. Okay. Think about in your faith community, if you're part of a faith community, is there somebody there? The pastor or the youth pastor or my aunt that also goes to the same church. Good. Think about in your neighborhood. If you're walking around your neighborhood, is there one person in your neighborhood that if you needed something, they would be there for you? Florida is a pretty transient place and people don't really talk to their neighbors unless there's a hurricane, but is there one person or is there not? You know what I mean? And so if you go through every domain and every aspect of your life, it helps you recognize either one of two things. Either one, I actually do have people, I'm just not reaching out to them. And that's on me. And I need to figure out how to ask for help or how to connect, right? Or the other thing you might realize is in every aspect of your life, you don't have people that you can lean on, the people that would be there for you. In which case you need to become intentional about building it.
Yeah.
And so what does that look like? Well, say I haven't been going to a faith community, but I used to. Okay, well then I'm going to actively seek some kind of spirituality or faith community if it's something that's important to me, and put it back in my life because that's where a lot of people get support.
Yeah. I think it's easy, I think it's easy to feel like, well, I'm so busy. I don't have time to go back and do that. Or I don't have time to meet somebody for coffee or meet somebody for lunch. But it's like anything, it's going to be hard either way. Like, it's going to be really hard if you get in a situation and you need like your community or something and you don't have one. And it's going to be hard to create one when you don't have one. So, like, choose your heart. I kind of hate that phrase, but at the same time, it's like, if you're gonna say I'm too busy or this really isn't all that important to me, then a time is going to come, because times do come where you're going to need something like this and it's going to be really important for you to have it.
Exactly. I agree.
Yeah.
And it's also, it's a investment you're making in yourself. We invest in ourselves in so many ways, but we don't really value this until you don't have it. Right. So it's just an ongoing investment that we need to make, just like going to the gym. Keeping up with your friends should be just like exercise. Because it's good for you mentally.
So are there characteristics of a strong tie that you need to be like looking for or make sure they're there so that okay, this is a person that I have?
There's different people have different functions in our lives, right? And so like, for some people, like my strong tie needs to be somebody that's going to go out with me when I want to, blow off some steam on a Friday night. That's my strong tie. For other people, my strong tie is going to be like, I really need somebody that can just come to my house and hang out with me when I'm having a rough day, or make me soup when I'm not feeling well, right? So different people, different jobs in our lives. And so I think part of that is recognizing like, what are your priorities? Like, I need somebody who's going to be my rock, that can watch my kids when when I need to do something for work, or I need somebody who's my have fun friend, have fun with friend, or my person that's going to motivate me to exercise, or whatever your needs are. Then you want to try to find those people or build those people into your life, so that they are meeting whatever your needs are, and it's different for every person.
Yeah. So when we're talking about like the loneliness epidemic and kind of how it is an epidemic and it seems to be getting worse, like what do you think the answers are to solving it or making a difference? Like, how can we as people, start to make a change?
I mean, that's a great question. And I believe in creating socially connected communities. I believe in creating socially connected schools. So, I mean, that's a lot of the work that I do is, how do we, in our place of work, in our neighborhood, in our school, create an opportunity for connection for people. And who has the time to do it for everybody? I don't know. But if you're doing it together, I mean, when my kids were little, I was really passionate about, everything being green and healthy, eating healthy foods, and my kids eating healthy foods. And, I had a group of moms that all of our kids were around the same age, and we were kind of all part of like this local moms club. And we decided to create a little club for the kids called Sprouts. And we got little t-shirts for the kids, and we did things like beach cleanups and whatever, and that was just, it came from our interest. Nobody had time, but it was something fun to do with the kids. We were all doing it together as moms. And it brought people joy, and it was meaningful to the environment, and it taught our children good lessons. And so things like that, where it's like, just find something that you're interested in and incorporate it into what you're already doing. You would be spending time with your children anyway, right? So you could spend time like with them. Like, I used to joke because my children were young and I was like learning about Medicaid. So I used to like read my children the Medicaid manual as their bedtime story. They didn't know what I was reading anyway. So as long as I said it with the right inflections, it was all good. And, but I could be sitting around doing that, or I could be sitting around doing something that's going to be stimulating their brains and being with other people in community. So creating opportunities for that, or just joining in if you don't have the time to be the organizer, just joining in for things like that, will create more of a connection for yourself as well as for others.
Yeah. So what if you can share, like what projects are you working on right now, or like what's kind of new and up and coming in your field?
In my world.
Mm-hmm.
I'm right now working on a project called Be Socially Connected, which is it's a 6-week cohort, like session for teens that are struggling with loneliness and isolation. It starts off, it's place-based, so it's like within a community, like within a city or within a school or something to that effect. And basically, you identify youth that may be struggling with loneliness or isolation or anxiety or depression, and teach them all about the social influences. So it's 1 hour a week on, a virtual platform. You learn about building social connections. You learn how to create social support. You talk about building social capital. You learn to manage your social media. You spend time talking about social inclusion. And then the last session is you meet in person. So you take youth that were lonely and isolated and struggling, you in a safe way, virtually. They get to know each other and meet each other in breakout rooms and things like that. And then the last session, they're in person. So now they have 8 to 10 friends
Mm-hmm.
in their community or in their school. And so I'm working with school systems and with community mental health providers to teach them how to use the curriculum so that we can kind of create this connections movement where
Mm-hmm.
kids are talking about how, a lot of people talk about connections, but they don't know the how.
Mm-hmm.
And I think that that's kind of like my area of expertise, with the book is like, just do the activities and the how
Mm-hmm.
will come to you because the whole book is about how. And so many people are struggling but don't know what to do. Well,
Mm-hmm.
there's lots of resources to figure out what to do. You just have to be able to pick one and just start small and move forward. So I'm really
Mm-hmm.
excited about that. And we're in the research stage. We did our first pilots and we're under evaluation. So I'm excited to see. So far, the preliminary results are very promising.
Awesome.
Yeah.
So how do you get that out into the world? Do you work with like nonprofits or schools directly? How does that whole thing work?
I do. I work with a lot of nonprofits and government
Okay.
entities. I haven't really put it out into the universe that much because we are just finishing up our pilot phase. So in the next year is when I'll be really looking to release it. But, I get invited to speak at conferences and I talk about, and I work with organizations when they're writing grants so that they can incorporate this
Mm-hmm.
material into their work. And I work within communities that are struggling and bring my research to them.
Yeah. So because I know I have a lot of listeners who have young children, what are like the age range that are most at risk for loneliness, or even like signs that you can surface or see from your own children if maybe this is something that they have going on?
Well, I mean, like you mentioned, 1 out of 3 people are experiencing loneliness. So there's a good chance that people, young people are experiencing loneliness. I think a lot of that has to do with, resiliency skills and teaching people, the protective factors and, social connections is one of them.
Mm-hmm.
Doing some work with Sesame Street to support young children and then caregivers and, people that work with young children to teach them about, promoting social connections. But I'd say definitely middle school is a difficult time for
Mm-hmm.
kids. Always been.
Mm-hmm. Mm-hmm.
Those early teen years, it really always been a difficult time. Our college students are reporting that social isolation is a challenge. The generation of youth that were, in middle and high school during COVID are
Mm-hmm.
struggling a lot.
Mm-hmm.
I think, it's a conversation to have with your child. Is,
Mm-hmm.
have you ever felt lonely? Or telling them sometimes I feel lonely. And
Mm-hmm.
have you ever felt that way? And just having an open conversation. The thing I like about talking about loneliness is it's one thing to say are you depressed? And there's sadly, there's a stigma around that and people don't want to admit it.
Mm-hmm.
There's a little bit of that with loneliness, but since it seems to be more universal, people are more comfortable talking about it,
Mm-hmm.
especially when you share an example. Like, I feel lonely when you're in the house, but your bedroom is closed and I'm sitting in the living room by myself. That makes me feel lonely. Have you ever felt lonely? And then letting
Mm-hmm.
your child there's so many ways that you can connect with your children, even using the platforms. Like one of my sons, he used to love to watch, like TikTok, at the end of the day, like it's like his thing. He wanted to like, relax. And I would say like, okay, you can have like, 20 minutes by yourself, but then I want to sit down and let's watch together. And I would say to him, like, show me the funniest video you watched today. And then he would show me his video, and like that tells me one, what he's watching, which is nice for me to know. But also we can connect over that and laugh over it. And then I would show him one of mine, and he'd be like, "Oh, come on, you're so old. That's not funny." The old people yelling at each other or whatever I'm watching that I think is funny. But so you can use some of these things that we're worried about to actually connect.
Is there a difference, a big enough difference to matter between feeling lonely and feeling left out?
I think they both make you feel crummy, right? They really do. I would say some people who feel left out do feel lonely. Like they feel lonely that their friends are doing something that they're not doing. And I don't know that we necessarily have to differentiate, but that's a really good question. I feel like I would want to look into that a little bit more.
Yeah, I'm just thinking like, as if I think about middle school Kelly, because middle school is the worst time in life for a girl or for anybody really, but there was a lot of like feeling left out, but I'm not sure if I would have described it as lonely, and maybe like left out or jealous or whatever. So as you were talking, I was just curious would a child describe it as lonely, or would they use other words, and does it matter enough in that conversation that they're talking about it in a different way?
I think just having a conversation is a beautiful thing, right? So it seems like we are kind of afraid to talk about emotions with our kids sometimes. When they're younger, it's easier because you're talking about mad, sad, glad, and like they're pretty, what you see is what you get, But as you get older and the language becomes a little bit more complicated, I love Brene Brown's Atlas of the Heart, where she really just describes emotions so beautifully. It's such a great tool to like help us get in touch with our emotions, but really to be able to explain emotions to other people, especially young people. But yeah, I think any conversation that you have is a good one, and feeling left out stinks. And just to be able to be present with them, and, not like, oh, don't worry about it, you'll be invited the next time, but just like, oh, I hate that feeling. I remember when I was in middle school and I felt left out. Like that really sucked, and that like if we can just be present in that, then we're helping the person that's we're talking to.
Yeah. Yep. A lot of good stuff in there. Well, I love, I think, I've had this realization that this is an area of life to focus on, but I really love like the research behind what you do to prove that it's worth the work and the effort to make these changes and make these investments in your life and your relationship, because there are real, tangible, like health benefits, life, longevity benefits, all of these things. It's crazy how much, social and relational health matters to your physical health and everything else like that. So,
yeah, I mean, it feels a little fluffy, to talk about like the social influences of mental health. It just does, I didn't like, okay, I'm a researcher. How did I get to this space where this feels so fluffy? But in reality, there's so much science behind it that people just don't realize. I mean, even now, doctors are prescribing, they have social prescriptions where they're prescribing you to spend time with other people, recognizing that it has an impact on your physical health outcomes. And so I love that we're beginning to really recognize that it just needs to be incorporated into everything that we do. And like within organizations, if you're going to be working virtually, okay, but what's the plan for bringing people to in person to connect? Fine, if we're going to work virtually, when will we be in person? Those kinds of things. I think we need to incorporate it into our everyday actions whenever possible.
Yeah, I agree. Well, thank you so much for sharing and all of the things. If somebody listening wants to find you or connect with you, what's the best platform for them to follow along and see what the work that you're doing?
Oh, thank you. Well, yeah, so you can definitely find me on like Instagram or LinkedIn. Here I am talking about how bad social media is, but there's my social media stuff. We can put that in I know it's terrible when I do presentations. I'm like, and at the end, connect with me. And here's my social media. And then, my websites, Collectively Us or julieradlauer.com. And of course, the book Connects 100 Ways to create happiness in your life is always great. So hopefully you can put all that into the
Yep.
show notes.
It'll all be in the show notes, and I can give my endorsement of Connect. I'm kind of like just working through it, but it's very like interesting, eye-opening, and really, if this is important to you and you're an area of your life that you're working on, it makes it feel like there are like tangible things that you can be doing to make a difference without just being like, well, maybe I should go to a networking lunch. It's like, what do I really need to be doing to be making a difference?
I think that's what you just said is really important. Like, it's one thing to just do things because that's what you think you should do. I'll go hang out at the park. But if you're not a person that can strike up conversation with a complete stranger, going and hang out at the park is not going to be a way for you to build connections. So recognizing like what your strengths, interests, and talents are, and then matching that in a way. So I'm more of a one-on-one kind of person. So I'm going to sign up for an art class, or I'm more of a group person. And so I'm going to, go someplace where the groups gather, like a team sport or something like that, but recognizing where you get your support from, and nurturing yourself in that way.
Yeah. Thank you so much for sharing your time and everything like that. I will include all of your links in the show notes, and I definitely encourage everyone to follow and keep up with what Dr. Julie has to say, because it's important, and the science and the statistics tell us that. So we can all do our part. Yeah.
Thank you so much. I love what you're doing, and I love the show.
Well, thank you so much. I appreciate it. Have a good day. Thank you all so much for listening to this episode. It's truly an honor to help bring these conversations to you. I do have a couple of quick favors to ask of you. While you're listening to an episode, could you take a screenshot and post that to your Instagram stories and tag me at Life Intended Podcast? And just let me know what your favorite takeaways were or what you liked about the episode. It really helps me to learn more about what you love and want to see more of. And if you have a few extra minutes, if you'd go to iTunes or wherever you listen, I'd love it if you could leave me a rating and review. Ratings and reviews are one of the best ways new listeners can find the show, and I'd love nothing more to grow this and help more people live a life intended. See you again here next week.